A couple walk in late. Give me 1 sec.
Yeah, nothing to rush.
Why did that zoom in on you? I don't know why our camera is so small, but there we go. I'll move it around. So this is Dr. Akehi from University of Kearney. He's going to talk about their Masters of Athletic Training program. He is the program director, and I'll let you take it away.
All right, sounds good. Well, thank you so much for having me today. How you guys doing? Ready for the fall break?
Yep.
Cool. All right. Greg, let me share screen if you don't mind.
Yep.
Or if I can do.
I can't wait for something like that.
Maybe. All right.
Sorry, we use Google Meets here, and it throws everybody for a loop.
Yeah, it's okay. It's all right.
Yes.
So let's see what I can do here. Well, I'm having a little issues, but let's see.
I need to do something.
I am sorry, guys. All right, do you guys see this?
Yep, there we go.
All right. Well, so sorry, guys. Okay, so my name is Dr. Kazuma Akehi. I'm a program director for the athletic training programs. Also, co-department chairs for the kinesiology and sports science as well. So I've been teaching, these universities for 10, 11, 12 years now. And then I'm also alumni of this program as well, too. So it's always nice to come back to the our alumni schools to and then teaching. I'm originally from Japan. It's hard to tell, right? So whenever I was at your age, I couldn't really speak English at all. So it is it's interesting how I still stick here, and then I went through this my careers. So it's just an intro here that as I went to Kearney here at UNK's, and then it was pretty good at the time. Athletic training is being offered in the undergraduate programs, and then I went through these programs at UNK's 20 some years ago, and then I went to the Central Oklahoma for my master's, and then of course at that time I already practicing as athletic trainer, and then I went to the Oklahoma State for my PhD. So so I did a lot of academic work in the Oklahoma, and then of course in Kearney as well, and then I came back. And then, what I did in my careers while I'm in the Oklahoma is I was an athletic trainer for a Team USA, specifically for the Paralympic teams. So the person have physical disabilities. So the person, doesn't have arm, doesn't have legs. They lost their legs or arms or limbs because of the car accident, cancers, unfortunate military duties. They kind of lost it, in the actions. Some of them are, special force, so everything is classified documents. So couldn't really, share anything like that. A couple of them had some gunshot wound to the spine, and then they had to use a wheelchair. So there's a lot of things going on in that world. But I had a chance to work with Team USA in the Paralympic teams the last, not last, excuse me, for 5 years or 6 years when I was in Oklahoma. So primarily, I work with the sitting volleyball teams that you can see on the screens, hopefully on the left side. So like most of them doesn't have a one or two limbs. And then I also had a chance to work with the wheelchair basketball teams. And then once in a year, Oklahoma in that area, we host special events for the Endeavor Games. That's what it's called. Meaning is basically a recruitment event, and then we actually had that for 3 or 4 days straight athletic events for any level of the athletes, and then any of the competitive athletes as well too. So they join us, experiencing some of the new sports they like to join, or they just trying to be qualified to be getting to the USA team. So it was very nice to work with those such athletes as athletic trainers. And then this is a very non-traditional settings for the athletic trainers to work with. Typically, as you may know, the athletic trainers work in the university settings, college settings, local PT clinics, hospital groups. Those are main way to go. But I had a chance to work with those populations, and I had such an amazing time. And then on the same time, while I was taking the master's degrees and the PhDs, I had a chance to work with those teams as well as the athletic teams as well too. So when I was in Oklahoma State, I could be sideline for the football games to providing the all the medical cares. Also, I served as a athletic trainer for the NBA Oklahoma City Thunders as well too. Specifically, I started with the game coverage in the home games for the Oklahoma City Thunders. That's a first year Oklahoma City came from a Seattle's. So that's whenever the KD's Westbrook, James Harden, all those trio was a super young, like first year rookie season. That's when I had a chance to be there with them. And then I transitioned to the more entertainment departments, which is, how you can kind of see on the background that I had a chance to work with the Oklahoma City Thunder Girls, which is a more promotions, dance teams. So I had a chance to work with those athletics. And then, of course, on the Friday, I had a chance to work with the Otho, Oklahoma, which is a hospital group in the Stillwater, Oklahoma. I had a chance to work with the local high schools Friday Night Light, and then go to middle of nowhere in Oklahoma, and then cover the sports. So I did a lot of traditional sports coverage as athletic trainers, being on the field, on the sideline, and then helping those, and then taking care of all the trauma problems. Have a lot of minor injuries too, of course, some rehabilitations as well too. As a part of my duty as a PhD, which is under a more academic route, which is required to have a more research studies. So while I'm on the field doing all the athletic training cares, but also I studied as well too. So one of the first study that I did, you can see on that on the a lot of cables on one of the patients or one of the subject leg is we trying to measure how electrical EMG's signals changes by using the different shoe insoles. So, I wear a lot of different hats to, approach the athletic training practice. So, whenever I was there in Oklahoma for 6 years, I did a lot of different things because as an international student, I didn't know what would be the best suited and then what kind of be happen for the immigrations. So that, I literally did everything I could think of and then trying to make options for the future careers. So, a lot of athletic training students currently in the program now as well my students straight go to the full-time job after that, or get some other, whatever they want to do. That's awesome. But at the time when I was a student, I wanted to have a lot of different options to get the full-time job. So I did a lot of different things, and then now, I ended up as a program director here at UNK. And then I'm sharing a lot of different stories, a lot of different experience I had in the past to our students as well too. Of course, some of the courses is very traditional. So, injury care prevention classes to injury assessment class, therapeutic intervention classes. I will talk more of those list of the courses later. But, I had a chance to talk about those traditional courses, but also the lab as well too. So there's a lot of hands-on stuff, my students doing it, and then, experience all aspect of the athletic trainings. So those are all of my students in the current programs, or some of them actually last year's. So like pictures from the last year's group as well too. So we do a lot of professional collaborations. Fortunately, University of Nebraska Kearney is under the University of Nebraska system, so that we do a lot of a collaboration with the Omaha, Lincoln, and then medical centers group as well too. Also, our program work with a student health groups as well too. So you can see the IB lines on the left top corners on the screens. That is the my students doing the IB with one of our nurse at the student health. So we do a lot of collaborations with a lot of different professionals in our curriculums. So sometimes students go to our surgeons to observe the surgeries, or go to the doctor's office to doing evaluations or reading the x-rays or MRIs, or as we traditional settings, go to follow the specific athletic teams to doing the injury care preventions, to injury assessment, rehabilitation, treatment, all sorts of things. So this type of the hands-on experience will start from literally from the day one, once they you guys come into our programs, and then they learn from the mistakes. So that's part of my philosophy, is students need to make a mistake and then learn from it. So there's a lot of opportunities that students make a mistake, and that is completely okay. Of course, students make the same mistakes, then we need to kind of a little bit talk or kick their butt. But other than that, we definitely are providing great opportunities for a lot of different students go through. Yeah, those are just keep continuing. So like some of the stuff, since we're in the middle of the Nebraska, some of the our students interested in the more rodeos, or kind of a little bit different non-traditional settings. So we send the students to the North Platte or some other places with the Justin Boots medical sports medicine groups, to experiencing the rodeo type of the medical cares, which is great. It's an awesome experience. So if any of you guys are interested in that type of the athletic trainings, we certainly offer such opportunities. And then some of you guys may interested into the Division I athletic settings or rural high school settings. Whatever the needs in our program try to meet. So we sending the students a lot of all over the places in Nebraska, and then also sending the students to the outside of the state for the clinical educations or clinical rotations as well too. So that's one of the students with the cowboy hats. That's one of the students had a clinical experiences, and then some of the pictures again coming from the all of my students doing the sideline jobs, to the all the ankle evaluations, some of the injury care preventions in the state wrestling tournament. So if any of you guys when you're in the high school in the state of Nebraska, if you run cross countries, or if you did a wrestling for the state, some of you guys probably came to Kearney, and then I was a kind of one keep yelling to the runners to keep moving at the finish line for the cross countries, because they tends to pass out there. But students are definitely the first hand to taking care of those athletes to work with. So those are the class pictures. So students definitely have a lot of hands-on, like I already talked about it. But also this is a graduate level courses. So students have a professional development opportunities. So we take students to the national conference, the district conference, and the state conference as well too. And then some of the students present their clinical studies or their original research studies as well too. So we are not stick with the regular class teachings and learning type of style. Definitely this is a higher education, so students need to bring the topic they want to research on. So if any of you guys are interested into, hey, I want to know about these supplements, how those supplement works, or specific training protocols, or some of rehabilitation modalities, how those works. Okay, textbooks say this way, but is that true? Or nowadays the social medias, right? There's a lot of workouts or some injury care prevention type of the stuff. Is this really working, or is that true? So they we actually test those out, and then see, oh yeah, those are just scam, or we find out, oh, this is a pretty rigid thing, so it's we better to implement. So it is a always interesting that students get the extra opportunities to learn from. So I'll just keep continue, keep working on this. So we covered a lot of stuff, and then sometimes we just dunking the ice water as part of the practice of the heat emergencies. And then one of my students got guinea pig there, and then yeah, it is really cold. She's super healthy. She's not that heat exertions, a heat stroke at all. So she's just screaming out of her lung after we dunked the ice water. But we also does a 3D motion analysis because of my background, biomechanics. I do a lot of biomechanical analysis in my labs, and then students kind of testing out how those works after the post ACL or post hamstring issues, all that stuff. And then we do some casting practice, all other stuff. So as a program, so as you may know, that athletic trainer does a lot of different things, and then our curriculum meeting the those needs, and then let the students experience. So as you know, that our program is very competitive. This is nothing really changing. Omaha campus has athletic training programs. Lincoln campus has athletic training programs, and the Kearney campus here has the same curriculums. So we do have a maximum numbers that we can accept. We do have a review all of the transcript, GPA recommendation letters. We check all of those as well too, and then we try to do the interviews and then trying to find students match with our programs. Because of that, we have such a great success. As a program, we have a 100% board of certification pass rate, 100% job placement so far. So we have and then also 100% or 98% of the program retentions. So we doing such amazing job, and students doing a fantastic job. So we definitely have those competitive admission process. Maintain that program is a very quality, and then students gain appropriate knowledge. So some of you guys maybe too early to think about it, about the admissions to the master's programs, but this is pretty common or typical admission requirements across United States. We definitely want to see some cover letters or letter of interest, and then a minimum GPAs to our graduate program is a 3.0 out of 4.0 overall. Last 3 years, our cumulative GPA's average is about somewhere between 3.5 to 3.8. So they tends to have higher GPAs, but you know GPA is just GPA, right? Sometimes you have some hard time in some of the year semesters. We fully understand that. So I don't want to discouraging any students because of the just GPAs. It's most important things is why you want to be athletic trainers and what you want to do with that degrees or professional certification. So as long as you have a clear goal or um, good academic and professional career goal, we respect that. So if you have a 3.0, that's still fine. Okay, so I want you to make sure that keep pushing to maintain a good GPAs. And then CPR AD certifications. If you don't have a certifications or it's already expired, we will recertify you anyway, so you don't need to worry about too much. But another things I really pay close attention to is the recommendation letters. So if you're athletes, we want to see a good recommendation letter from the professor or coach. If you shadowing any athletic trainers in your schools or in your local PT clinics or any other stuff, I want to hear from them as well too. So that's exactly what we're looking for on that. And then if in case if you are international students, we need to have an English proficiency test scores. If you graduating that your schools or any other institutions, then you don't need to take any of the English proficiency testing at all. And then our programs, we require to have a 45 credit hours to complete. So they will start from the summer term, and then fall and spring, and then we have another summer, and then fall and spring. So total the 6 semesters, we will complete all of those credit hours. As you can see on the pictures, if you go to unk.edu/athletic trainings, you can go to the athletic training page, and then in the catalog, you can see the series of the courses. As you can see in the bottom half, the KSS 885 to down, those are all the clinical related courses. So you go to our UNK sports medicine or local high schools or other universities or hospital clinic. There's a lot of clinical experience you gain from. And then towards the end, graduate seminars, that is the prep course for the BOC, the Board of Certification exams. So, you'll take a certification exam at the end of our curriculums. So, and the unique things that our programs offer is the graduate assistantship. So we have a 4 part-time graduate research assistantships, which providing a tuition waivers, monthly stipend, that. So some of the students definitely keep pushing to the doing the research, and then get such positions. So once this position is available, I typically announce to the programs annually, and then we will find the right fit persons for these assistantships. So if you need additional stipends or additional financial support, our programs support that as well. Unfortunately, I cannot offer such positions to everyone, so it's need to be very selected on that. So what questions do you guys have?
What questions?
How big are your guys' class? Like a class size?
Yeah, class size is about somewhere between 10 and 13, 14 students. Currently, we have a class of 12 right now, so we definitely have more rooms to fill as well.
And how much is like tuition?
Tuitions will be, if you're in state of Nebraska, I believe that it will be $230 per credit hours, I think.
And out of state?
Out of state, I think it's going to be double on that.
What's the max size your cohort can be?
Maximum size, it can be somewhere between 16, 17, 18 students. This is some of the numbers we need to talk to my clinical coordinators, because those are fully rely on how many students I can send it to the clinical site. So, some of the years, we kind of a little bit fluctuate, but we definitely, can take to, that numbers.
How many typical applicants do you get?
Last year we got a 21 or 22 applicants, and then 4 or 5 of them withdraw because they got accepted to the other programs, and then others I didn't accept, and then 12 of them committed.
Nice.
And then UNK is the cheapest in the tuitions compared to any of the schools in the state of Nebraska, in both undergraduate and graduate. So I know some of you guys may thought that tuition is expensive, but it's actually not. It's the cheapest. So that's some other stuff I can kind of trying to push it to sell as well too. And then number of the credit hour requirements as a master's degree, that is definitely way lower than other schools as well. Some other schools require you to take a 65 credit hours I've seen in the neighboring states. So ours are 45. So definitely, it's different curriculum for sure.
Can you talk about the practicums and their clinical rotations?
Yep. So we send the students in each semester in a different locations based on the experience you like to gain, also some of the preference you may have. So some of you guys may, I want to be athletic trainer for the NFL teams or D1 football teams. Then we kind of trying to match those, needs or interest as well. But on the same time, as a program and then education purpose, because of that, I want you to go to the basketballs or wrestlings or soccer's, the other sports or some other clinical educations as well, because you may only get some specific injuries or cases in some certain sports. So we intentionally sending the students to the variety of locations. So and then some of the students definitely more college oriented, but definitely one of the semester you experience in the high school settings, or go to the specific clinical cases or clinic or hospital area as well. And then in the summer times, we typically sending the students to the surgery centers as well too, so that specifically follow the ortho physicians to learn about all the surgical techniques, learn about the post PT rehabs, so that we send the students to the PT clinics. We also send students to our local family doctors, so learn about the non-ortho injuries or ortho conditions as well too.
What's a typical class day for the student look like then?
So students only take a 3 courses or 4 courses, including a clinical class. So you only have a class. Let's see what they have first year. First year they have one class on Monday in the mornings, afternoons, or another one, and then a couple classes spread out to the Tuesday, Thursday, or something like that. So there is a variety of the open spot in their schedules. And then they go to the clinical rotation. Some of them go to the part-time jobs, something like that as well. So definitely there's a room for it. A couple of our athletes are athletes currently in the roster. So some students go to the soccer practice or games, or football practice and game, or track and field. Those are pretty common sports that we typically have.
When do they typically do their immersive experience?
Yeah, immersive experience will be a second fall semester for first 8 weeks. Some of them start from the August in the summer, but we typically send the students to specifically directly related to their future jobs or area they want to work at. So students specifically go to the specific schools or clinical settings, and then spend 6 to 8 weeks with the preceptors.
Do they take classes during those immersives too, or classes are off?
No, it's completely off, because the students have to work with athletic trainers literally full time on that week. So we don't offer any of the courses that time. But once students come back after fall break, we will have 2 or 3 courses.
Application deadline. What's the application deadline?
April 1st for our accelerated students. So students, already in UNK as undergraduate students, those students have to submit by April 1st. If you're only looking for that, only traditional 2-year cycles, that will goes to a May 1st. So if any of you guys, about to graduate, this year, and then interested into the, looking into a Master of Athletic Training programs, so next May will be a deadline. But I highly encourage to apply earlier because I'm doing a rolling enrollment, meaning is what rolling admissions. So sooner you apply, we're gonna start accepting students. So we definitely encourage all students to apply early.
We have all different professions in this class. We have chiropractic, students interested in PT, OT, athletic training, strength conditioning. What's something you look at on applications that makes an applicant stand out?
So any of those professions is pretty common for our programs. So our students who graduate here last year, one of them went to the chiropractic, two of them went to PT, and then another one went to the PhD, and then another one went to some other places, and then rest of that are full-time jobs. So definitely some students see the good connections having a dual credentials as athletic training and PT, athletic training and OT, athletic training and chiropractic, and athletic training and sports performance or strength and conditionings. So as long as you have a kind of clear goal on those, I'm okay with it. And then of course, handful of students only commit to the athletic training. That's completely fine as well too. So as long as you have a kind of clear goal or clear career that you want to do, I think that should be fine. And then we also have international students had no clue or no previous experience whatsoever, and then apply it because they want to be athletic trainer or sports medicine, providers. So the most important part is you have a kind of clear visions to commit these programs or professions. So it doesn't really matter. The students already have 100 hours of the clinical observation hour or shadowing in the undergraduate. Yeah, that's awesome. But we do that in our program anyway. So it doesn't really matter that how 200 hours on the PT observations or 300 hours of the AT observations. Yeah, I really appreciate it, but that's not the top priority things we see.
What are the top priorities that you're looking for?
Yeah, so top priority, like I said, we after reviewing the mission documents, we do one-on-one interviews. Oh, excuse me, 3-to-1 interviews. So like our faculties and the students, and then we ask the series of the questions. So we can kind of definitely feel that students have really committed to these programs, or there's I just want to be AT because I love the NFL. Well, that's not the right justifications to pick this clinicians or clinical professions. So we definitely have that conversations and then kind of clarify what is going on here. So of course, higher GPAs, good, those higher number of the observations, good recommendation letters. Yeah, those are definitely the good. But ultimately, that conversations in the interviews, I think that is the factors we decide to say this person is getting in or not.
You mentioned international students. What opportunities do they have if they want to go back, or if they want to go back home outside the United States?
I think it all depends on the country. Meaning is each country have a different medical systems and then credentials that they can practice with. So athletic trainings they do a lot in US. But for example, if they go back to Japan with that, they really cannot do evaluations, or they cannot really do a emergency or trauma cares. That's a doctor's. So depending on which country you going back, then their practice format or style will change. But commonly, we see the students from the Japan, Canada. We just accepted the one student from the UK for next cohort. Those are pretty common one. South Korea, yeah, that area. Yeah, those are the 3 or 4 countries that commonly we get.
Your graduates from May of 25, where'd they end up for full-time positions?
Yeah, full-time positions. A couple of them actually still in the Kearney area, hired by their clinic or a hospital. Some of them went to two of them went to the rural area of the high schools. One of them is from their hometown, and then one of them went to the completely other locations. I think it's Columbus or somewhere in the hospital groups. And then one of them got a full-time job at some other university in Kansas. I think that's it. And then rest of that went to the chiropractic schools, 2 went to PT schools, and then one I cannot come up in my head right now, but somewhere. Yeah. Oh, sorry about that.
Any other questions? Everybody's good? One last question I have. Do you know the salaries that some of your graduates are kind of starting out with?
Yeah, graduates. I think if I remember correctly, the lowest I heard is a 55, and then the highest they can go, anywhere above that. So I think that's what I know of. The highest one, I don't know that. There's a couple suspicious that they go to close to the 70s. Because they hired by the clinic or hospital group because they needed it to fill that positions. But I think that's all I know of.
Good. All right, no other questions? All right, give my hand. Thank you very much.
All right, thank you guys. Appreciate it. So if you have any questions, here's the contact information. So just let me know.
Yeah. You do any like informational or campus visits or anything for students?
If the student's interested in contact with our admissions office, and then they can schedule all the tour of the facilities and then campus. Also, they will schedule to meet with me as well too. So that's probably easiest way to connect. But otherwise, you can shoot me email, preferably then a phone call, and then we can go from there.
Okay, sounds very good. Thank you so much.
Yeah, no problem. Thank you for having me.
Yeah. Oh. All right, what did everybody think? Oh, I can't leave with